the Affordable Care Act, conceived in 2008 and finally birthed in 2010, brought many changes to the U.S. healthcare scene. No one can argue that. But while it was unable to actually live up to its namesake and provide affordable healthcare, it did make a lasting impact on our overall healthcare system. And therefore, it needs to be understood because our healthcare system is not working. Spoilers. And in order to understand how to fix a problem, we need to first understand the actual problem. So, welcome to part 4 of my healthcare deep dive series, where we are trying to do just that so that we can fix it. Please help me fix it, please. This video is our second where we are focusing on the Affordable Care Act, and I'd like to start the video off with a general question. All right, ready? Do you know how insurance works on the marketplace? That's the place where you buy the Affordable Care Act insurance, in case you weren't sure, because I sure as heck didn't until I kind of started looking into all this and wrote this. And I'm a nurse practitioner and have worked in healthcare, providing care to patients with this insurance, relying on it for over a decade. So that's super good. But after this video, you, my friend, will know more than most of your healthcare providers about the insurance found on the Affordable Care Act marketplace. You will have the knowledge not only of what types of insurance plans became available under the Affordable Care Act, but also how they decided who gets what. Spoiler, it's barbaric. Proceed with caution. May you use this knowledge to become just as angry as I am, and may it fuel your fights on Facebook with your friends from high school's random uncle who you feel the need to correct, or who knows, maybe even some conversations will occur that will eventually lead to a better healthcare system for all of us. We can always hope. Let's begin. Hello there. If you are new, I'm Liz. I am a family nurse practitioner with over 10 years of healthcare experience, where I got to see firsthand just how much harm our healthcare system is doing. It's a lot, in case you didn't guess. If you would like to see some of the examples or hear my story of what got me so mad about all of this, I will leave all of those linked down below. And if you missed part 1 of this entire series, where we went over the basic changes of the Affordable Care Act, we're going to call it the ACA from now on, just so you know, because it's shorter. You'll want to give that a watch as well, just to get some background information on the topic that we won't be repeating here. Things like what exactly changed in terms of the laws and such surrounding the changes, what the timeline was. And you'll get to hear all about how people who have healthcare conditions finally were allowed to purchase health insurance. It was mind-blowing. It was a really good time. It's a really nice way to raise your blood pressure if you would like that. But good news, because of the Affordable Care Act, now you are allowed to have high blood pressure. So you win some, you lose some. Thank you, Affordable Care Act. Let's take a look at the types of insurance plans available on the marketplace via the ACA. And remember, these plans that are purchased on the marketplace are for individuals who are not necessarily offered insurance by their employer, or who just want a different plan than the one that is provided by their employer, if their employer provides it. And if you're sitting there like, why is she talking about people's employers? In the United States, fun fact, it is largely expected that the employer will provide the health insurance for their employees, except a lot of the times they just don't, which is fun. And it definitely seems like a weird, overstepping boundaries thing for your employer to do, to pay you a salary and also be responsible for your health. So that's odd. So this video is really focused on those who are getting it through the ACA, who don't get it through their work. The same general rules apply to people who are getting it through their insurance with their employer, but it's not exactly the same. So this video is not explaining those. If you want a video on that though, and kind of look into the healthcare provided insurance through your employer, do let me know in the comments below and we can make that happen. So you might be sitting there saying, hey Liz, how many different types of plans are there with the Affordable Care Act? Friends. Hundreds. maybe thousands, but they are all clumped into different tiers to keep things simple. There are fancy tiers for the best humans, and by best I mean the richest, because that's how the government and healthcare in general decided that they would calculate human worth, was their literal net worth. What could go wrong with that? And then we just kind of go down from there. There are 4 basic plan tiers of insurance offered through the Affordable Care Act. There is the bronze tier for not valuable people, the silver for people with some value, gold, humans pretty much worth valuing, and platinum for the rich, I mean the best humans. Although if you have ever browsed the marketplace and you're like, Liz, I've never seen a platinum plan, don't worry, friend, your eyesight is totally fine. Platinum plans are not like very popular due to their high monthly cost. So because a lot of people can't afford them, if the healthcare people at B survey an area and decide that most of the humans living in the area can't afford it, they just don't offer those plans there. Because where there is not as much money, obviously there is not as much of a need for excellent affordable healthcare. Only the best people need that. And if the best rich people don't live there, then we don't need that. In addition to the metal plans, as they are commonly referred to, the marketplace also offers something called a catastrophic plan. And those are, well, catastrophic and not super helpful to the people who generally need them. And I also would like to discuss the marketing person who was like, you know what, we could call these. Hold on. Catastrophic. And everyone was like, that's a great idea. Let's go with it. Moving on. So now that the powers that be have divided up the humans into their different categories based on their worth, how do insurers and marketplaces actually divide up the plans and assign them to the people and their worth? Individual plans are categorized as one of the metal plans or a catastrophic plan based on the actuarial value. Now, if you are like me and have you will basically just have a basic high school education of economics, which is to say no real economics education because you spent all of econ talking to your friends and gossiping and doing your homework for your other classes. You're probably wondering what that means. Because this means that the plans are ranked based on how much of your healthcare you as an individual actually pay for and how much the insurance will pay for. And going into this, it's important to understand that the value isn't calculated per enrollee, but is instead calculated across a standard population. And as I am saying that dictionary definition, that is not helpful. Let us further break down the definition I just said so that we can understand what that definition means. According to verywellhealth.com, this means that if a certain plan has an actuarial value of 70%, the insurer will pay 70% of the average healthcare costs across the whole population. Not 70% of each enrollee's cost. So we're going to pay 70% of Liz's cost this year. No, it does it across the population using averages. So we'll just use me as an example. When I just bought insurance on the marketplace for my family, P.S., I'm a bronze human, lowest. Well, I guess there's catastrophic below me. But when I bought it, in order to decide how much healthcare costs my family would rack up, the insurance actuaries, they averaged out all the other young families with our similar demographics in the area. And they said, we'll cover 70% of the average of all of those costs. Except I don't think mine is anywhere near 70. I think mine is 60 or less, but whatever. So this means some people who have super high healthcare costs would benefit from the insurance plan because their $500,000 medical bill after they got in a car accident will certainly exceed what they will pay into the insurance. And for the majority of the other humans with the plan, we will pay more into it than we are actually able to use. Again, that leads back to we don't use almost any of our actual healthcare because by the time we pay for the monthly premiums, then we have the deductible, and that creates a barrier to even going to seek care. But again, different story for a different day. But that is the tangent on how insurance companies actually decide the tiers, how they break them up. The fancier tiers for the best humans cover the higher percentage of the total cost. And then the lowly bronze tiers for worthless people like me cover a very small percentage. All of this, again, very complicated, and please feel free to read the example from verywellhealth.com to get the general idea for it. But for now, that's what we've got. Maybe in the future we'll do a financials video. I'm sure we will. Best suffice it to say that this can lead to some really big variation in the actual percentage of individual enrollee costs that the insurer will pay, because some people are going to have crazy costs and some people have none. So, in case you're ever wondering, that's how insurance works. Also, if you want to get paid, I mean, oodles of money to put a monetary value on human life, you too can become an actuary. And in that job, you will literally calculate like how much is human life worth, how likely are people to die, and when, and how, and very fun, very morbid, very sad, very twisted, but lots of money. With all that out of the way, let's dive a little bit deeper into the 5 plan tiers. And remember, from our last video explaining the ACA, that one of the new rules is that each individual in the US has to have health insurance. And if you choose not to have major medical health insurance that meets the federal standards for more than 2 months in a row, you have to pay a fine. Although, let's remember that very few people want to actually not have health insurance. They're not like, you know what, I don't want health insurance. They can't afford it. So that's why they don't have it. So we fine them money they don't have for not having insurance because they couldn't afford it. Logic. I would like to point out that starting in 2019, the penalty was waived at the federal level for not having insurance, but individual states could still impose this fee, and some states decided to keep it: California, Massachusetts, New Jersey, Washington, D.C., Vermont, and Rhode Island. Please check out the resources listed below in the description for more details, because the exact penalties and fees, they vary state to state. It could be its own video. New tagline. I feel like we need a mug. Be like, that's its own video. Also, since it's been a while since the plans were initially made back in 2014, they've obviously gone through some changes. The video today is going to be focusing on how things are today, but the general gist, honestly, has remained remarkably similar the entire time. I thought before we got into more of the examples, I would also just lay out a few more preemptive things to get going. A few terms, just so you would know, kind of, we all know where we're coming from, because some of these things get really confusing. Insurance is just a mess. First, what is a deductible? A deductible is the amount an individual pays before their insurance will start to pay. This is things like going to the doctor's office, having any procedures, any lab work. You pay out of pocket until a certain point, and then they're going to start to pay. It usually excludes things like annual checkups and preventative screenings. Usually they will pay for that before you hit your deductible. But remember, as with all things here, it varies by your plan, because equality doesn't matter here at all. Go figure. Just how worthy you are, aka how much money you have or who you work for. But we'll cover that in a totally different video where we talk about the employer side of it. And we can touch on how ironic it is that the people who vote on these laws that now are like making our lives impossible have fabulous insurance provided by the government, like people in Congress and the Senate. And so they aren't affected by the laws that they enact, which is just fascinating and a total side point. Good times. But deductibles are usually thousands of dollars and usually have a personal max and then a family max. So for example, my personal maximum is $7,000 per person, or if we're fortunate, yay, enough to hit it, $13,000 for our whole family before they will start to pay. But only when we hit those milestones. So something to hope for. Next, we have copays. What are those? A copayment, more commonly called like a copay, is a fixed amount an individual pays for a covered service after a deductible has been reached. Within individual plans, copays vary for different services. What you pay for your annual visit or like a regular visit to your primary care is different than what you pay for a specialist, and so on. Some people have relatively low deductibles, so after they pay, several $100s, their visits to primary care are only $35 a pop or something like that per visit. You can probably guess who gets those plans though, the gold and the platinum people. If you are a bronze person, well, they don't like that here. You probably won't have a copay. And last, what is a premium? what the premium is what you pay every month for the honor of having health insurance. This is the price that will vary based on a million different things: your income, your health history, do you smoke, do you not, where do you live, what day of the week were you born on, how valuable of a human are you, normal things to just ask people. So this does not count towards your deductible. This is just the monthly fee for having the right to have some coverage of some of your healthcare costs as long as they are approved. My premium is currently $1,300 a month, in case you were wondering. I felt I needed to tell you. It bothers me. Let's take a look at these different plans. In order to compare prices and services, we will be using my sister as our secret shopper, because that way she can look through some of the plans and we can see like what would it cost for her. It's realistic, it's probably more applicable, and it's far less depressing than looking for my family of 4, which was very expensive. So we'll be looking at plans for a 30-year-old female who lives in the greater Philadelphia area, who is not a tobacco user, with no spouse or children, and with no major pre-existing health conditions outside of hypothyroidism. This is all information that's collected before you are given the plans so that they can decide how to price it and put you in the right group with people like you in your average. So in case you're looking at this and it looks different than your marketplace, Pennsylvania has their own marketplace. It's called Penny. It is basically the same exact thing, other than it's monitored by the state, not the federal level. So it's just, it makes everything more confusing. Pennsylvania really likes to make things as confusing as possible. It's just to be more fun and complicated. Like, you can't register your car if it's raining outside. That's a rule. I found out because I went to go register my car recently, but it was raining and I couldn't. So anyway, and disclaimer number 8 million, please remember that these plans are offered in her specific zip code for a person of roughly fitting her parameters. Remember, we take the average. They're going to differ even within the region based on health status, and will definitely differ based on where she lives, because why the heck not? We all know that people change their value when they move across certain geographical and visible lines, obviously. So just something to keep in mind. All right, with that out of the way, let's go. We're going to start at the fanciest end of the spectrum, because why the heck not? Let us first look at the platinum tier plans. Healthcare.gov does recommend these plans for individuals who need very frequent and/or major medical services. Why is that? Because while they have the highest monthly premium, they have the lowest out-of-pocket costs at the time of service. These plans cover 90% of medical expenses. Remember, that's like based on the average, the actuarial value, so not like someone's actual 90%, but I think you get it by this point, leaving the individual responsible for just 10%. And this, you might be like, oh, that sounds good. But it has to be weighed against the monthly costs. In my sister's area, which is outside Philadelphia, Penny doesn't offer platinum plans because there are not enough valuable people there, apparently. But we look at some market research of just like the general population. 2021, the average premium for an ACA platinum plan was $709 a month for a 40-year-old person. So not quite the same as Rachel, but close enough, closer than she would probably like. Deductibles on these plans averaged around $459. So that's the amount of out-of-pocket that they would have to additionally pay before insurance was like, I guess we'll do our job and like kick in. Again, that's going to vary based on age, region, and tobacco use. So at $709 per month, you are looking at, which is the premium, you're looking at $8,508 per year, which is a rather large chunk of change. But if you are expecting your medical expenses to exceed that and you can afford it, and your city is deemed to have enough fancy people to have a platinum plan offered, maybe it's not so bad of a plan. But this does run on the theory that if you have an exceedingly large medical problem, like in general, you also obviously have exceedingly large amounts of money, which is so not the truth. It's also where the whole issue of people's inherent value equals their monetary value logic kind of fails, and no one seems worried about that, which stresses me out. And once again, because of the sheer amount of financial information surrounding this whole situation. That will have to wait for like a different video where we break down the costs of things, but please do subscribe if you want to catch that when it comes out or any other videos. And like this video, all the things. Like this video if you like it. The YouTube gods really love that. And I love it. And if you would like to know what I don't love how health insurance kind of completely ignores the data from studies that have shown individuals with lower income report poorer health and have more like comorbidities, more medical conditions. So really, these plans are likely never used by their intended population, those with more medical needs, because the sicker population is also the one that can't afford it. Also, they don't live in the place where the premium plans are even offered. So it doesn't really make sense. The premium plans are only offered in places where people spew money and just drink juice and kale and can see the doctor every 2 seconds for every sneeze and are overall probably healthier. Make it make sense. Okay. So for the almost as worthy humans, we have the gold plan. Gold plans pay an average of 80% of the healthcare costs, leaving 20% to be paid by the individual, but they also have a relatively high monthly payment. Now, what does this look like kind of number-wise? As an example, in my sister's area, the lowest plan available is $390 per month, and the most expensive is $640. These are going to come with varying copays and deductibles. The plans on the less expensive side of the spectrum have a max deductible of $2,500 annually, and the most expensive has a $0 deductible. So you could just come right away and start paying copays. Out-of-pocket maxes are going to range from $4,400 to $8,500 annually, which is still a lot of money, let's be real. At the most expensive end of the spectrum, you could be paying $7,700 a year. And you're still going to have to pay $2,000 to hit your deductible before they pay for anything. So for those who are a little bit less deserving, we'll go down the ladder even a little bit more. We have silver plans, which cover an average of 70% of healthcare costs, leaving you 30% for enrollees. As you can see, there are a lot more options at this level because we're entering a range where more people can afford it, so there's all sorts of choices. And they have so many different things that can vary in these, so we're just going to try to find some averages. In her area, these plans range from $390 a month to $540 at the more expensive end. Deductibles get complicated here. As you can see, the plans offer more than one estimate. That's because some of them have a separate medication deductible in order in addition to the standard medical deductible to help you pay for your prescription costs, because not only is your healthcare a service with a surprising price that you don't know until you go to pay it, but your medicine is too, and your insurance doesn't necessarily cover your medicine anymore when you get to this tier, and your insurance can decide to stop covering randomly your medicine, fun fact, or decide you've had enough of it in your lifetime. They're like, you don't need any more Zoloft, you're good. The amount of letters I've signed and fought with of insurance companies of them being like, they don't need that medicine anymore. I'm like, I think they do. I'm the one that wrote it. They're like, no, they're fine. It's astounding. Anyway, for those plans, the highest out-of-pocket max is $8,500 and the lowest is $4,800. And the deductibles are ranging from $300 to $7,500-ish annually. Next. Welcome to my zone. For people like me who are just very undeserving of healthcare due to our lack of value, there are the bronze plans, which cover about 60% of your healthcare costs, leaving 40% for the enrollee. And they have the second lowest monthly costs, but the second highest deductibles. So they're aimed at people who don't expect to use their insurance that often. In her area, we see the difference between the highest and the lowest cost is actually pretty close. The lowest being $294 a month and the highest being $360 per month. Interesting, if we're looking at this, the plan with the highest monthly cost is not listed as the highest expense plan. Both of those have lower monthly costs, $323 and $331 respectively, but they're actually labeled as being the most expensive. And we can kind of look at why just to understand it. It comes down to additional expenses. And this is what I was talking about where no one accesses the care because they nitpick over everything. And as you can see, it really gets detailed and complicated, but we will kind of go in with our in a future video mug. And when we dive into like the financials on what it actually looks like for an average person, maybe we'll really shop around for insurance. Maybe I'll show you how I shop for insurance. And we'll see there. But this has a big range. Just know that deductibles are going to range here from like $5,200 to $8,500. Out of pocket max ranges for like $6,900 to $8,500. And remember, all of this is for one person, for one human. If you have 4 humans in your family, if you have more than 4, how do you do that? Yeah. And lastly, here are the aptly named catastrophic plans. Basically, these are catastrophic and are intended for individuals whose other option was to not have insurance, for which they might be fined. They have the lowest monthly cost, but the highest copays and deductibles. They are basically intended for you to have, but not to really use. The literal only point of having this is to like not pay fines prior to 2019 when that was a thing. And maybe to help you out to not hit bankruptcy were you to require medical care, like, and you weren't anticipating it because, everyone anticipates every accident they're ever going to be in. In my sister's area, there are 2 plans offered to her for catastrophic plans. One costs $259 a month and the other costs $295 per month. Both of these have an annual $8,550 deductible with a same matching out-of-pocket max. So, they're expensive. Even the catastrophic plans are expensive. And the thing with these plans is they don't really cover much of anything. They don't cover any benefit at all other than 3 primary care visits per year. They will contribute towards that before an individual meets their deductible. Now, being a primary care nurse practitioner, let me tell you about how absolutely useless 3 visits is. And this applies to all of them, like a huge barrier to care. First, if you have your annual physical where your insurance will literally not allow you to bring up any concern other than preventative health screening. So any concern that you would have to be at your second visit. If they see you're documenting a concern other than something having to do with your preventative health, they will charge you. They'll come at you and you'll get fined and they'll say you're fraudulently billing. So any kind of issue would be worked up at your second appointment. And then your third visit would be to just make sure hey, are things okay? Did we implement a change? Did we start you on a med? Are you still okay? And then you would need one more visit a little bit later, a few months out to make sure long-term we're not causing harm. But you would already be at your 3 visits, so you're done. If you get sick, if anything happens, that's it. You cannot have any medical concerns if you have this. So in essence, this does nothing. And if you happen to get, like I said, sick or something happens, you're out of luck. This is why people are so sick in this country. We make visiting healthcare providers so prohibitively expensive that people only go when they are so incredibly sick that they can no longer ignore things. And by then it's so bad that we can't go back and reverse things, and lifelong illness and injury is going to be there. Versus if we had just let people come in and discuss their concerns without making them pay hundreds of dollars way back when things were just starting, we would save billions. And I'm serious, billions of dollars, because we would have caught the high blood pressure and high cholesterol that led to Uncle John's heart attack, not when he required quadruple bypass and presented to the emergency room with a heart attack and then required 2 weeks in the intensive care unit, but we would have discovered it 2 decades ago when we could treat the underlying cause with a lisinopril pill, something that costs nothing. But wait, there's more. If you thought catastrophic plans were over, we're not done. If you are over 30 years old, you can't just buy catastrophic insurance. Oh no. You must first apply for a hardship exemption if you're over 30, which can only be claimed under specific circumstances. They weigh them individually. Not all hardships are considered equal, which is a very American mindset, where you're like, well, your trouble is okay, but your trouble, that is not okay. That hardship is not, we don't deem that bad enough. So here's what the hardships are that could be considered. 1, you are homeless. 2, you were evicted and were facing further eviction. 3, you received a shutoff notice from a utility company. 4, you have experienced domestic violence. 5, you experienced a death of a family member. 6, you experienced a fire, flood, or other natural or human-caused disaster that caused substantial damage to your property. 7, you filed for bankruptcy. Okay, there, medical bankruptcy is the number one reason for bankruptcy, so this ties in nicely. 8, you had medical expenses that you couldn't pay that resulted in substantial debt. If that isn't the most ironic thing I have ever heard of, I do not know what is. 9, you experienced unexpected increases in necessary expenses due to caring for an ill, disabled, or aging family member. 10, you claim a child as a tax dependent who's been denied coverage for Medicaid or CHIP, like the children's a special health thing, and another person is required by court order to give medical support to the child. In that case, you don't have to pay the penalty for the child. That one seems weird. 11, as a result of an eligibility appeals decision, you're eligible for enrollment in a qualified healthcare plan through the marketplace, lower costs on your monthly premiums, or cost sharing reductions for a time when you weren't enrolled in a cost plan through the marketplace. 12, you were determined ineligible for Medicaid because your state chose not to expand eligibility for Medicaid under the Affordable Care Act. And 13, the exemption for grandfathered individuals insurance plan is no longer available for, well, that changed in 2017, so that one didn't matter anymore. Or 14, you had some other hardship. All of these, in order to actually even apply, require a different form, and they're complicated, and they all require approval individually. Like someone just can sit there and be like, I don't think that was a bad enough house fire, denied, and they can be denied. So let's remember that. And while this sounds great, and this seems to cover a lot of bases, this only applies to catastrophic plans. So in that fire that didn't destroy your home, if you suffered severe burns and needed extensive medical care, you would still need to pay the $8,550 before insurance will cover anything. And that is only if the ambulance took you to an in-network facility. And don't even get me started on in-network and out-of-network issues. Cheers with our later mug. So it's just really not a good option for anyone, but at least the catastrophic one, but at least you're not getting fined and you might not go bankrupt. Cheers. So what does all of this data actually mean in the real world? People with catastrophic bronze and silver plans honestly rarely use their health insurance, even though they pay for it monthly, and they pay a lot, because by the time they pay their monthly premiums, so many people, me included, so many of my patients cannot afford the cost of actually using their healthcare, because remember, going to the healthcare provider is going to cost hundreds of dollars, and insurance still won't pay unless you shell out your $8,000 deductible and reach that. People with gold and platinum plans are much more likely to use their health insurance because the cost barrier at the time of use is lower because they have lower deductibles. But you need to pay a ton of money monthly in order to get those plans. And for many, that's just not financially viable. It creates a huge gap in care between individuals who are better off financially and then the rest of us who will be paying off our $13,000 babies. Normal delivery, mind you, I had like very little intervention. I did have an epidural, worth every penny. But $13,000 for a baby that we're going to be paying off forever. And then we can't access basic healthcare because we can't afford the cost despite being a primary care provider. And it's so many people. It's not just me. It's so many people that do not receive healthcare because they cannot afford it, despite having insurance, despite having jobs, despite doing all the right things. And it just has to stop. Looking at this, I mean, between the fines and the high costs, people were obviously concerned about the financial implications of the ACA. And the government said, well, I have an idea. We'll help you out with subsidies and tax credits for your health insurance. And friends, if you thought this was complicated, you just wait until the next episode where we're going to dive into subsidies, how they work, who can get them, where the heck the money comes from to pay for them, all of those shenanigans. It's going to be a good time. Thank you for spending your precious time with me today and learning a little bit about our healthcare system. If it made you feel a certain way, let me know down below, or like the video or comment or share it. It helps the video reach more people, and the more people we reach, the quicker we can start to fix this mess as we understand it and can come together to fix it. I appreciate you learning with me, and I look forward to next time. See you then, my lovely unworthy humans. Because let's be honest, I feel like most of the platinum humans clicked out of this video quite a while ago. All right, bye. Cheers. That was cheers with our invisible merch mug. See you next time.